Hello, I'm Alex Metricardi, Chief Marketing and Public Relations Officer for Living Branches, and today is Thursday, December 31st. Welcome to you. Welcome to Ed Brubaker, our Living Branches President and CEO. Hasta la vista to 2020. Glad to be putting that in the rearview mirror.
Yeah, that's right. You're quoting Arnold Schwarzenegger, right? Yeah, and I think this is episode 33. So we have not done these every week, too. So when you say 52 weeks in a year, it's been a long time when we think about it, since March or April, probably April when we started these. So it's been a long year, and one year that I think we're all eager to put in the record books. Still a lot of learning that we had, and there were good things that happened as well. But for the most part, I would say it was a really hard year, and I think we're welcoming the opportunity and the hope that things will be different in 2021.
Yes, I've come to the acceptance that the first week of January is not going to be very significantly different than the last week of December, but it still does seem nice to turn the page. Yeah. Well, let's start with a roundup of where we are with COVID-19 on our campuses. At the Willows of Living Branches, we continue to have no residents or staff testing positive at this time, which is very good news. At Dock Woods, our persons in residential living who had tested positive previously have all recovered, and so they are now moved into the recovered category. In Dock Terrace, our skilled nursing area at Dock Woods, we have 4 residents now that we would consider still having COVID-19 symptoms, and we've moved 4 into the recovered category. Among those is our 100-year-old plus resident, so that was very nice to see.
Yeah, that goes to show you that, what your age is doesn't always signify what the outcome is going to be for the disease. And it impacts people differently. I know there was a 41-year-old, I believe,
I just saw
congressperson-elect from either Alabama, Louisiana, I can't remember which state, but he passed away. And it's very sad to see that, 2 young kids. So while that's not the primary category of person, meaning age category, it does impact people in different ways. The other thing to keep in mind, too, is that COVID is not N-O-T. It is not the flu. The flu primarily is a respiratory impacting disease, and COVID can impact almost all of your bodily systems, your heart, your lungs, many different things. And so the symptoms that are created to equate it with the flu is really just an incorrect statement, and I think one that we need to keep preaching, because it is very serious. Not that the flu is not serious, but it is impacting essentially your respiratory system.
I was talking to someone who works here this morning, and they were sharing that one of their relatives out in California had tested positive, and they were talking with this person a day or 2 ago, and he said that literally everything hurt, including his hair. And he was saying, I know it sounds ridiculous to say that, but my hair hurts. He's like, this is unlike anything I've ever experienced before.
Yeah. And I think actually I had seen something on Instagram or something that somebody was brushing their hair who had COVID, and their hair was coming out. So, it just impacts basically all different bodily systems, and it can be different for different people. So it is absolutely not the flu. And so I don't think as many people are saying that anymore, but we need to keep combating those, frankly, false narratives that are out there that we need to keep working at.
Well, at our Satterton campus right now, we continue to have 1 residential living resident who's testing positive. In personal care, we have 4 persons who are testing positive. And in healthcare, our skilled nursing area, we have 8 people who are testing positive. We have moved 3 to the recovered category in healthcare. But for the first time this week, we did have 3 persons at Satterton pass away, which is something that they have not experienced before. And I think we would reflect that perhaps some of those we're not surprised at that. They had been medically fragile before, but at least one I know was a real surprise.
Mm-hmm. Yeah, there was one that was a surprise, and I believe the monoclonal antibodies were not given in that particular case. And again, people choose one way or the other, and that's totally up to them. But we have experienced, I would say, overall fairly positive results with the antibody treatment. The challenge is it doesn't work for everyone, and I believe there were some people that passed that had gotten it. One of those being, I think, a person who had been on hospice pre-COVID. So those are the things we need to keep in mind, not to minimize the passing of anyone, but the reality is other realities of our health conditions do impact our ability to fight any kind of disease, whether it's cancer, whether it's the flu, whether it's COVID. And so those things need to keep in mind as all those studies are made. But yeah, it was a sad time at Satterton because we've had overall very good experience there. But we did have some persons who tested positive who did subsequently pass as well. Yeah. Mm-hmm.
Well, from a resident question perspective this week, all of the questions that I've received have been the exact same, and they all are, when can I get my vaccine? So perhaps we should talk a little bit about that. And we have new information to relay, I think, from the last time we spoke. Unfortunately, we've had updates from CVS, so why don't you share what we've heard from them?
Yeah, and I'm thinking back to last week. I think we recorded on Christmas Eve, and I think it was after the video that we actually got updated information because we were being given dates as to when our vaccine clinics would be from CVS. And I think then it was Christmas Eve that we were told that at Dock Woods, instead of being January 7, it was January 2nd, which is this coming Saturday. So not only was it changed and it was earlier by 5 days, it was also on a weekend day. So you do what you can, you make changes, but that's just an example, not to complain about it. The logistics of this are challenging. But having said that, it's just people don't always understand how we're scrambling behind the scenes. And then they see the hopefully typically very organized front of the house, but it is a challenge to keep up. And there's been other changes too. Another of them being that we anticipated that we were going to be vaccinating personal care residents. And just earlier this week, we were told that no, they're not going to be in this phase. And so that's the challenge. We need to go with what we're told by CVS, who's vaccinating, but it just illustrates that things are dynamic and they continue to change, and we need to work at that. And so there's a lot of scrambling that I know you did and many other persons to make this happen and get organized so we're ready for Saturday. And I feel pretty good about where we're at, but it took a lot of work by a lot of people to get us to this place. And I just want to acknowledge that and recognize the work that you did, but also many other people as well.
I do try to remain sympathetic to the fact that they're attempting to roll this out across the United States, and it's complicated enough for our organization, so I can't imagine what they're going through. I know our personal care residents and families are going to be extremely upset about this decision because so many of them had already been emailing in to say, yes, please put my mom or put my dad on the list. So just to clarify, for personal care and memory care, we will have another clinic date where they will be vaccinated, is our understanding at this time. We do not have the date. And I guess I also want to say, we did everything we could to try to figure out how to override that decision. So we talked to a lot of people, we put a lot of pressure on people, and we're just unequivocally shut down and said, no, this is not something that we're doing right now.
Yeah, that's right. And I guess I would just highlight your comment of this is our understanding today, December 31st, whatever the time of the day is. And so we need to keep that in mind because we will let people know as soon as we know, but we need to know that we don't know all the answers and all the details, and things are changing on a regular basis. So we do what we can. We do the best we can with what we know and what we have.
Yeah. So I will be excited next week to be able to report on what happened at our clinic. We did have a chance to learn from some of our sister communities who had already had their first clinic, and it went well. They did not experience any really severe or significant results from allergic reactions or any of those horror stories that you hear. So I was very pleased about that.
Yeah, and the feedback that I'd gotten from their CEO was that they did not have anyone. I think they had 160 employees that were vaccinated on Monday. They did not have any persons that had symptoms that were significant enough that they would have called out of work. So that's 0 out of 160. And, there's been, I don't know what the count is now, but it's north of 2 million people in the United States that have vaccinated. Still, that means there's a long ways to go because there's 300 plus million in the United States. Having said that, when you hear about this one person here and the one person there, certainly I understand the need for us to be aware of, but you need to look at the entire data points to really understand the significance, because if you have 2 people vaccinated and 1 had adverse reactions, that's 50%. If you had 2 million people vaccinated and you had 10, that's not 50%. So we just need to keep, the data in mind and make sure that we're looking at the entire picture.
We've spent a lot of time, it seems like, in the last couple of weeks talking about vaccines. But another very complicated process that's continuing to happen on our campuses is testing of staff and residents in some cases for COVID. And we've made a change this week, really, to the process that we're using to do that. So maybe we should share a little bit about that as well.
Yeah, and we're looking to make the change partly because we now need to go to twice weekly testing because of the positivity rate in Montgomery County. So we can't, frankly, afford to do a $60 PCR test when it may be paid for by insurance, but if it's our health insurance and we're self-insured, we're paying for it anyway, as opposed to covered by Medicare with our residents. Now, at the end of the day, I know that you and I are paying for that too. So, there's no free lunch, so to speak. But the point is we needed to find a different way. And the BD test is an antigen test. And so we're going to begin with that next week. We also feel like there is some promise in the Abbott Binax Now test, which is a different type of test and actually still an antigen test, but easier than the BD test to administer. So we feel we need to go in those directions because while I believe we're still at about a $30 a head price point for the BD test, the Binax Now gets to about $5 a head. And so when you're literally testing hundreds of staff people in a week because of the twice weekly testing, you really need to find something better than $60, even though $60 was a very good price for that from our lab. We've spent, I think in November it was 80 or 90,000 just in staff testing. And so it's added up to hundreds of thousands. So we cannot continue to do that in the long term, particularly when we go into twice weekly testing. So we're working at that. The challenge is that the reality is that the antigen tests are not the ideal test for persons who may be asymptomatic but positive. Okay, so they're most accurate, as we would understand, from this testing that they did to develop them in persons that are symptomatic. But at the end of the day, I know another facility in APG that I think has done 5,000 BD tests and maybe had 25 positives and maybe 5 to 10 of those were false positives. So there is some good experience out there. And so we're confident that we can make it work for us. And frankly, we need to make it work for us.
Well, and I think the other thing that maybe is a positive of this type of test is that you get the results in 15 minutes.
That's right.
So our lab has been doing a nice job for us, but it's still taking 36, 48 hours to get results back. So to have that essentially while you're still in the testing area will be wonderful, because then if you do test positive, we will send you home immediately and proceed from there with our process.
Yeah, and that is an excellent point too, and that is a very important point. The other thing that I'd like to say too is that with our lab, they're, as part of their fee, inputting the data into the state websites, okay? One of the other things that's going on and has been going on for almost since the beginning, there is so much data that we need to report to the state, federal, and local authorities about this. And it's stuff that we do, but it is an impact on our organization, an impact on our leaders, an impact on other administrative persons. It's an organizational impact that really is draining at times. And in the particular, there's a federal place that we input the data that it's almost like breaking into Fort Knox to get people their credentials to actually be able to put in the data. And that system is so backed up and overwhelmed, we have not been able to get more people to be approved for that. And I say that not necessarily, maybe it's partly belly aching, I'm sure it is, but it's also to say there are so many things like that, just to illustrate for the viewing audience that there is no clue by the general public, and which is fine, that happens in any industry, but there is so much work that is going on behind the scenes by our team. And I just want to say again, kudos to them, because it's been, when we say it's been an unbelievable year, it's been an unbelievable year. And you can say it that just from the things that are publicly observable. And I'm saying there's a lot of things that are not publicly observable that are going on in our organization that is causing stress and strain and anxiety, et cetera. And I just want to acknowledge that and again, express appreciation for the people that have been involved in that way.
That talking about reporting of data reminds me that I had an email this week from somebody who's saying, why don't you guys report into the systems? I can't find your information anywhere. And I think perhaps they were looking for living branches and not Satterton Mennonite Homes or Dock Terrace or Dock Woods. So just a reminder for folks, if you are looking at the data that the state provides, we're not listed as living branches. So yeah, you have to look us up by entity, but I was a little bit taken aback by the email because I thought, oh, if you only knew how much data we're reporting.
Yeah.
But we have no control over what the state does with it once we've reported it.
Yeah, that's exactly right.
So, good. Well, do you have anything additionally that you'd like to say before we head out for the year?
Yeah, and someone had just emailed me Auld Lang Syne that they were playing, I believe, for the residents, and they said, I think there are some residents in their party hats at 8 o'clock this morning. So I think people are ready to say goodbye to 2020. As we said earlier, that doesn't mean it's going to magically be better, tomorrow. But it is certainly, we are on a progression to get to a better place. And last week I made some kind of end of year reflections too about some of my hopes and prayers and thoughts for 2021. And I won't repeat those necessarily. But I am hopeful. I really am hopeful. But it does require us to participate. Mm-hmm. Okay? And when we think about the vaccine, I know there's a lot of fear out there. And part of a fear of, is there a side effect? Will it hurt? Will I have pain, afterwards? Will I be impacted negatively? And I don't want to minimize that because those things are real. I mean, we're human beings after all, and I recognize that. But I think, on Saturday when I get stuck with that needle at 10:30 a.m., I also need to think about not just me, but I need to think about what I'm doing to help the collective we. I think Dr. Hamowitz talks about it's not just me, it's we. Change one letter and you change significantly the meaning. And so I just like to keep pushing that out with staff, with residents, with families as we think about the continued need for mask wearing, even after getting vaccinated, the physical distancing that we need to continue, the things that we need to continue to be disciplined with until we get to that place of herd immunity. Let's think about the we. So my arm may hurt after Saturday. Maybe I'll have a bit of the fever. I don't know what my symptoms will be. But I have to remember it's not just about me. It's not just me that I'm getting that vaccine for. Yep. It's the collective we in Living Branches, the collective we in southeastern Pennsylvania, and the collective we in the United States, and frankly, the entire world. because we, particularly as Christians, are not just, residents of the United States. We are world citizens, and we need to think about our brothers and sisters across the planet. And so that's maybe my word. Let's continue to be disciplined. Let's continue to be thinking about that, but let's think about the we. Let's make that our goal in 2021 too, to be less self-centered as Americans. And I truly do believe, and I'll say I myself as American am self-centered and individualistic. Let's keep thinking about the we, because we need to act on we to get to the other side. Because it's important for me to get vaccine and our staff to get vaccine so our residents and their families can have a better life too, and can see their families again on a more regular basis in 2021. So it's not just about me, it's about we.
Yep, absolutely. I think getting families back together again is what our focus is. Yeah. So, well, Happy New Year.
Thank you. Happy New Year to you.
Thank you. Happy New Year to you, and we will see you next week.